So my name's Dr. Jess Deighton. I'm Associate Professor in Child Mental Health and Wellbeing at UCL, and I'm Deputy Director of the Evidence-Based Practice Unit, which is across UCL and the Freud National Centre for Children and Families. And I want to share with you some of the learning that's initially coming out of the HeadStart programme. So HeadStart is a 5-year programme that's funded by the Big Lottery Fund. It's happening in 6 local authority-led partnerships across England, and they are focusing on trying to support emotional well-being, mental health and resilience in children and young people between the ages of 10 and 16. We're at the fairly early stages of the programme, so we are looking to disseminate early learning at this stage. As part of that early learning, we've been carrying out surveys with children and young people across all of those partnerships to find out how they feel about their mental health and well-being. And what we're finding at this initial baseline stage is that children and young people are reporting quite high levels of mental health problems. So something like 1 in 5 children and young people are reporting experiencing quite high levels of emotional problems or behavioural problems. And we find some gender patterning to those results, such that girls are much more likely to report emotional problems and boys much more likely to report behavioural problems. So we find, for example, around 25% of girls are reporting quite high levels of emotional problems. And that finding has come up a couple of times in recent studies, so I think that gives us cause to think that we should be really focusing on what is causing such distress for children and young people. We also find that there are some risk factors, some things that consistently seem to be associated with higher levels of mental health problems, so things like deprivation, also special educational needs, and if a child is a child in need, so a child that might need some additional intervention from the local authority. These are quite early results. I think what's exciting with HeadStart is that we have the opportunity to follow these young people over time, to find out what changes for them, and also to see whether the support that's put in place through HeadStart makes sort of a positive impact on their emotional health and well-being over time. We'll be disseminating learning quite regularly throughout the programme, and you'll be able to find this on the EBPU website and the HeadStart Learning section.